In many Indian homes, the day a baby is born feels like a festival. Phones keep ringing, relatives start arriving with sweets, someone is already planning the Namkaran. And everyone keeps saying the same thing to the new mother. Ab to life complete ho gayi hai. You must be so happy. But on the fourth night after delivery, when everyone is asleep, the mother is sitting on the bed holding the baby and suddenly she starts crying. Nothing bad has happened. The baby is healthy. The family is also supportive. Yet, she feels overwhelmed, emotional, and confused about why she feels this way. Many mothers experience this, but very few talk about it. After childbirth, women can experience 3 different mental health conditions: postpartum blues, postpartum depression, and postpartum psychosis. They sound similar, but they're very different. Let's start with the most common one, postpartum blues. Imagine this situation. It's the first week after delivery. The baby is waking up every 2 hours. The mother hasn't slept properly in days. Relatives keep coming to visit. Everyone is giving advice: how to hold the baby, how to feed, what to eat. And suddenly she starts crying for no absolute reason. One moment she is smiling at the baby, the next moment she feels like crying. This is called postpartum blues, and it happens to about half to even 80% of the mothers. Why does it happen? After delivery, the body goes through a massive hormonal shift. During pregnancy, hormones like estrogen and progesterone are very high. But after childbirth, they drop dramatically within hours. On top of that, there is sleep deprivation, physical recovery from delivery, breastfeeding challenges, and the pressure of becoming the perfect mother. In Indian families, the expectations can be intense. A new mother may feel she has to take care of the baby perfectly, follow traditional rituals, entertain visitors, and always appear happy. All of this can feel overwhelming. The good news is that postpartum blues usually improve within 1 to 2 weeks of delivery, especially with rest and emotional support. But sometimes the sadness doesn't go away, and that brings us to our second condition. Now imagine the same mother 2 months later. The baby is growing, but she still feels constantly exhausted and sad. She may start thinking, maybe I'm not a good mother. Other women manage so well. Why am I struggling? This could be postpartum depression, which affects about 1 in 7 mothers. This is not just mood swings. Common symptoms include persistent sadness, loss of interest in things, extreme fatigue, feeling emotionally disconnected from the baby, intense guilt, and anxiety about the baby's health or safety. Many mothers feel ashamed to admit this because in our culture, motherhood is often shown as pure happiness. So when a mother feels depressed, she may hide it. Sometimes she hears comments like, "You just had a baby, why are you complaining?" Women have been doing this for generations now. These reactions can make mothers feel even more alone. But postpartum depression is not a weakness, and it is not bad parenting. It is a treatable medical condition. Treatment can include counseling or therapy, support from family, improving sleep and routine, and sometimes medications that can be safe during breastfeeding. With the right help, most mothers recover very well. Now let's talk about something very rare but important to recognize: postpartum psychosis. It happens in about 1 to 2 of every 1,000 deliveries. It usually starts within the first 2 weeks of childbirth. Instead of just sadness, the symptoms are much more severe. For example, the mother may become very confused, sleep very little for days and days together, say things that don't make any sense, hear voices, or develop unusual or dangerous beliefs about the baby. Sometimes families think that the mother is just very exhausted or tired or stressed, but this condition is actually a psychiatric emergency. Women who have bipolar disorder or previous postpartum psychosis are at a higher risk of this. The important thing to remember is that this condition is treatable, but it requires urgent medical care. Early treatment can prevent serious complications. In India, mothers rarely go through the postpartum period alone. Grandparents, in-laws, siblings, everyone is involved, and that can be a great source of support. Small things from family members can make a huge difference. Letting the mother rest, helping with night feeds, limiting too many visitors, listening without judgment, and encouraging professional help when needed. A healthy mother is the best support that a child can have. We talk a lot about the baby's health after delivery, but we rarely talk about the mother's mental health. Postpartum blues are common. Postpartum depression is treatable, and postpartum psychosis, though rare, needs urgent care. The most important thing that families can do is create a space where mothers feel safe to say how they really feel. Sometimes the most powerful question that we can ask a new mother is very, very simple. Are you really okay? Because caring for the mother is also caring for the child.